Well, welcome once again to Straight Talk. This is Kentucky Senator Gerald Neal, and once again, I'm delighted to have our listening, our viewing audience this morning. We have a very exciting topic this morning, which I will get into in just a moment. I do want to remind all of you that February the 2nd, we go back into regular session. We'll be dealing with some significant issues. Some of those issues, particularly related to the budget, will relate to the subject matter today, and that's the issue of COVID-19 and all that implies. But today we have a very, very special panel, and it consists of Dr. Lisa Fitzpatrick, an infectious disease physician and medical epidemiologist, and I want to know more about this, a founder of Grapevine Health. We also have Dr. Mark Burns, who is also an infectious disease specialist, University of Louisville educator in the field. I've met him before, and I'm sure he's going to tell me a little bit more about our interaction from the past. But these two individuals are specialists that can give you information that's very useful for you. So I want you to stay tuned. I want you to remember to share. But I have a very, very, very special guest and a friend of mine from way back, Delanor Manson, who is the CEO of the Kentucky Nurses Association, who's going to give us she's going to round out not only from her experiences of herself, but those that she represents, to give us more guidance in this area as well. So I'm telling you, this is an opportunity to get it straight. And that's what this is about this morning. So I want to welcome you. I want to welcome all of you all. How are you?
Doing great. Thank you for inviting me.
Outstanding, outstanding. So let's jump right straight into it. Let me start with Dr. Fitzpatrick, if I may, for just a second, because I want to know, what is the difference between an infectious disease physician, an infectious disease specialist, and an epidemiologist?
Oh.
Explain that to the listening audience, please.
Sure. Well, the infectious disease specialist and infectious disease physician are the same thing. So that one's easy. Just different terms for the same thing. An epidemiologist is a public health expert. So people who study disease patterns, population health, public health programs, mostly focused on prevention and wellness. So there are lots of different hats you can wear as an epidemiologist. Some people are researchers, purely academicians, or people who are in academics or the university setting doing research. Some people work in health departments, and then some are out in the community working on programs. So there's a lot you can do.
Now, I understand you're a founder of a group called our organization called the Grapevine Health. What is that?
Yeah, so a lot of health information is communicated, especially in our communities, by word of mouth or on the grapevine. And a lot of that health information is trusted information, but sometimes it's not true. It's not accurate. So our company is called Grapevine Health because we create a trusted, relatable health information content to help make the health system, sickness, illness, your body, less intimidating. We want people to better engage with health information so that they can make healthy decisions. And sometimes that's challenging because the language is complex, the health system is complex. So that's what we're focused on. And we do that for underserved communities primarily.
And where are you based and who are you affiliated with otherwise?
I'm in Washington, D.C. I am on the clinical faculty at the George Washington University School of Medicine. I also have an appointment in the School of Public Health at GW. I'm also affiliated with the Aspen Institute, which is a think tank focused on social policy, but I'm a health innovator fellow. I have other affiliations as well, but those are the main ones.
Okay, and we also have with us Dr. Mark. Wait a minute, Dr. Mark. That kills me, doesn't it? That's Dr. Mark Burns. I've been chasing him for 3 days. I can't get it out of my. Dr. Mark Burns. Now you are an infectious disease physician, but you also have an appointment at the University of Louisville appointment. Could you tell us more about that as well?
Yes, sir. I'm on the clinical faculty. I'm an assistant professor at University of Louisville School of Medicine in the Department of Infectious Disease. We do a combination of both patient care and also teaching of the medical students, residents, and fellows as well.
Okay, outstanding. So you see, I got these specialists here, but guess what? When I'm in a hospital sometime, and I was recently in a hospital, you may not know with COVID, one thing I noticed, it was the nurses. It was the nurses that I saw every day. It was the nurses that came in through that. It was the nurses that gave me comfort. It was the nurses that kept me up on things. It was the nurses that kept me on track and gave me what I needed as prescribed by the doctor, physicians as well. So we have Delanor Manson, who is the CEO of the Kentucky Nurses Association. Would you give us a little background on that organization and what it does, and tell us a little bit about the nurses' role?
Well, I am the CEO for the Kentucky Nurses Association, the Kentucky Nurses Foundation, and the Kentucky Nurses Action Coalition. We've been in existence since 1906 and primarily supporting the needs of nurses and focusing on the healthcare needs of patients. And some of the things that we've done in collaboration with the physicians and many other healthcare providers is make sure that patients get the education and the care that they need on the day-to-day, minute-to-minute basis. And so I like to tell people is that we need those physicians. But if you don't have nurses, you don't have anybody who's going to care for the patients minute by minute. So it is a collaboration, and without us all, it doesn't happen.
Well, let me say this to all of you. I take my hat off to you personally, because this is personal to me. This session is personal to me because the subject is about COVID-19 and all that portends. But the fact of the matter is, having experienced it and having been treated, diagnosed, treated, and cared for by doctors and nurses, I have a new appreciation for you. And I just want to say, those, we have a tendency to take for granted what you do. But the fact of the matter is that you save lives all the time. You dedicate your life to that particular piece, and you educate the public on how to negotiate life in a reasonable way in terms of your health concerns. So I can't tell you enough about how much I appreciate you and how much many people who I come in contact with are making those kinds of comments. Sometimes you might seem like you're being overlooked by some comments politically, but I guarantee you nobody's taking you for granted. Having said that, I want to get straight into it. I want to talk about this vaccine. I'm sorry. No, I'm not sorry. I want to talk about this vaccine. I just got my first vaccine the other day. They say once you've had it, you develop antibodies. But my doctor said, after you wait about 90 days, I want you to take this vaccine because we don't know how long this thing will give you immunization or give you protection. Dr. Fitzpatrick and Burns, would you please speak to that particular issue?
Well, first, let me just, I didn't thank you for having me on your show. So thank you very much. What I'd like to do is tell people that I was actually in a vaccine trial. I was in the Moderna trial as a participant. So I'll let Dr. Burns answer those technical questions, but I want people to know I made the choice, the decision to be in a clinical trial for this vaccine because I believe in the science behind it. So if people are taking medications and those medications are either prescribed by a doctor or over the counter, those medications all had to go through the same research process as the vaccine. So this is science we're used to. We just don't think about, we didn't think about before the pandemic. So I got my vaccine as well, Mr. Neal. And I've had 2 shots already. And I think it's so important for us to understand what's happening with the vaccine research process and to have some comfort that this is a safe process. It's not a new process for us. And I think the way out of this pandemic, in addition to all the public health guidelines and recommendations around wearing a mask and social distancing, we also have to have people take the vaccine. So I want my story to help encourage and educate people. So I'm happy to answer any questions related to that. So let me turn it to Dr. Burns to give you the technical stuff.
Thank you. Dr. Burns.
Yeah. The vaccines, as Dr. Fitzpatrick was mentioning, were manufactured, testing done here in the United States, and they encompassed a wide range of the population, not only of Black individuals, but white individuals, individuals of different ethnic origins. And the whole process was very transparent, and it is on the CDC website as far as the findings. Again, they were made here in the United States. The vaccines are very safe. We have 2 that are out right now with very high efficacy, 94 and 95%. The Pfizer vaccine and the Moderna vaccine, those are both available right now. Those vaccines are essentially the same. There are some minor differences as far as storage goes, but essentially they work the same. They're messenger RNA vaccines, and they have very high efficacy. The storage demands are a little different, as I sort of said. The Pfizer vaccine has to be stored at a very low temperature, 70 degrees centigrade, if I remember correctly. The Moderna one can be stored actually at normal refrigerant temperatures. So they can pose a mild logistical challenge depending on the area you're in. But again, as far as the vaccines go, they are definitely safe and effective.
And can I just add, one of the things I often hear from people, a lot of my work is actually on the street in the community talking to people about health issues. And we're hearing a lot of confusion and concern about the vaccines. And one of the most common things I hear is, well, I'm going to wait about a year and see if there are any side effects, and I don't want to go first. So I just want to remind people, the people who were in these studies that Dr. Burns was talking about, the Moderna and the Pfizer trial enrolled 76,000 people, half of which actually got the vaccine. So that means you're not going first. All of us who are in the studies, the thousands of people who got this vaccine went first. And as far as waiting to see the side effects, this vaccine went into people's arms in March 2020. So that means in just a few short weeks, we will be 1 year with information about side effects from the vaccine. So the vaccine side effects are well known. And even me, I had a low grade fever and I had body aches, but it lasted only for about 8 hours and then I was fine. Some people don't have any symptoms. So this is, as Dr. Burns said, this is a very safe vaccine and it works really well.
Well, I'm gonna tell you, I'm sorry, someone getting ready to speak. I had some reaction, and let me tell you, it was less than a flu shot. And I knew then, I said, wow, I took this on Thursday. Friday, I said, hey, yes, here comes that soreness. Never really got there, and it's gone. I'm ready to move on. Delanor.
I took my flu shot 3 weeks ago.
Yes.
And I'm going to take my booster on Tuesday. I had no reaction whatsoever.
A booster to the flu shot?
No. This is to the COVID vaccine.
Oh, okay.
To the COVID vaccine. I get my booster to the COVID vaccine on Tuesday. We've been working with LuVax, which is our drive-through immunization process at Broadbent Arena. And I've had several people come back and say, you know what? You have the softest hands. And I said, well, that's great since I wash my hands so much. but I had this soreness in my arm. I said, well, how long did it last? He said, you know, a whole day. And I said, it's gone now? Oh yeah, and I feel great. So we're hearing different things and different people talk about some of the reactions that they've had from the flu shot. But Dr. Fitzpatrick, what does it mean when you're having a fever after you've had the flu shot, or you're having some of that soreness? What does that mean? What do people need to know?
Thank you for asking that question, because I was going to respond to what you were saying. So it's like we're on the same wavelength. This is actually a good thing. When you have side effects, and I've had countless people say, I don't want to get a flu shot because it gives me the flu. And the reason people think vaccinations give them something is because they may feel a little sick several hours or maybe even a day or two later, but it's because your body is responding to the vaccination. So remember, the point of a vaccine is to trick your body into thinking it's had the infection. So it's showing your body the germ so that your immune system can prepare to, let's pretend it's putting on an armor to protect you against whatever that germ is in the event you come in contact with it. So with this vaccine, you heard Dr. Burns say it's a messenger RNA vaccine. What's happening is that little piece of messenger RNA is teaching the body how to create a part of the coronavirus that's responsible for making people sick. So it's showing, because the body has seen this, so the vaccine is showing the body what it looks like. It's able to prepare and mount a response. So it's all those reactions you're hearing about, or even in my case, I felt like I was getting beat up, like some sort of war was going on inside my body. But that's because it was preparing me so that I don't get COVID-19. And I'll have to say, if I have to choose between having 8 hours of feeling pretty lousy to getting COVID-19 and maybe even being hospitalized, I'll take the vaccine any day.
I can verify that. Well, let me ask you, Dylan, I'm gonna go back to you just for a second. You represent a lot of nurses across Kentucky, and I'm sure that you've come in contact and communicate with nurses outside of Kentucky on the national level as well. I'm curious as to the general experiences they're having in terms of people taking the vaccine. Are they seeing this level of resistance? Are they seeing an increasing number of people deciding to take it? What kind of dynamics are you perceiving out there?
Well, first, I'd like to say there are 88,000 nurses in the state of Kentucky. Many of those nurses work in rural areas. And so the reluctance to take the vaccine, even with healthcare professionals in the rural areas, has been a lot higher than we would like to have, because those healthcare professionals are coming in contact with people who actually have COVID, and they need the vaccine to protect themselves and to protect the people that they love. Nationally, we are still seeing some reluctance of healthcare professionals to take the vaccine. I think that part of that is that many healthcare professionals are not concentrating on the science. And we've had in the past so much dialogue about things that don't focus on the science. And so now we have an opportunity to really drive home the science of the vaccine, as Dr. Fitzpatrick said, is safe. And it's safe because it has been in the arms of people for 11 months. And those people, and we know what types of reactions they've been having. And it's safe because we didn't speed this up. I mean, it's been tested, it's been approved. However, I think we would be remiss if we didn't talk about some of the reasons that Black and brown people are reluctant to take the vaccine. Some of it has to do with confidence in the science, but some of it has to do with historical perspective of what has happened to Black and brown people in the United States for many years, as well as what's going on today.
Yeah, let's hold that point because I want to drill down on that a little bit.
Okay.
It's a very important area. Stick a pin in that for a minute. I want to get to
Okay.
Dr. Burns on something that I believe he was the one that said earlier that you can take this vaccine, but there still may be a period, or there may, later on it may lose its efficacy or something of that nature. I don't think you said that.
No,
It
no,
hasn't run 3 years, so we don't
right,
know when it might lose its efficacy. Let's put it
correct.
that way. So there
And
still is a
just
need
to let
to
people
use.
know, efficacy is how well it works. It works
Thank,
really well.
thank you so much. You get caught up in your own stuff, right? But the question I have is, if you take this shot and you've taken the second shot, someone might think that they're protected and they just go on about doing what they normally did before
Mhm.
COVID hit. Make a comment on that. What does that mean?
Well. In essence, when you get your second shot, and if you have the reactions like Dr. Fitzpatrick had mentioned, that as she said, that is a great sign your immune system is working. Okay, but that's the way it is for you, which is good. But you still need to practice the public health measures. That is, wearing the mask, washing hands, social distancing, avoiding crowds, those types of things. That still needs to happen. And we really need a large proportion of the population to get those numbers down that we have, all the positivity rates, get all the numbers down of positive people that are there. Again, bring all the numbers down before we can begin to have some semblance of our previous normal. Okay, but yeah, I mean that's in the offering, that's in the future. But in the meantime, even though after you get your shots, you still have to do those public health measures. Um,
Okay, so let me go a little further in that. Then I'm going to come back to Delanor after this, but I want to get to this question of individuals not wearing masks.
mhm,
I really want to get to that. You're saying to us, these are the measures that scientists are suggesting that we take to protect ourselves,
mhm,
but just as importantly, those that are around us.
mhm,
But we're also saying you're taking a vaccine, you have to have so much of the population inoculated, or it has a moderated positive effect on the general population. In other words, if you have 50% of the population inoculated, that's a different result than if you have 70%. Explain that a little bit. Why is it so important for a certain number of us to participate in being inoculated or vaccinated um, with respect to this COVID-19 piece?
Okay, well, this is definitely a question for Dr. Fitzpatrick with her training in epidemiology, but I can say this: we talk about herd immunity, and according to the World Health Organization, according to them, they don't really have a definitive number to attain herd immunity for COVID-19. Now, there are other numbers, like for the measles vaccine, there was, I believe, it was like 95%. But and the polio vaccine as well too. You have these numbers to get the herd immunity. That is to get the number of people that are infected to bring that total number down, which is important because if those numbers are down, then you're not spreading the disease. But again, I think this is more of a question for Dr. Fitzpatrick.
Well, we're hearing a lot about herd immunity. And, one saving grace, or I would say one silver lining of this pandemic is Dr. Burns and I, we have been trying to get people to think about infectious diseases forever, getting people to wash their hands.
Mhm.
So knowing that the public is learning about these things, I think is really great. The concept of herd immunity is really about, does the virus have enough places to go to continue infecting people? So the virus has to find a host, and that's us in this case. So if you have 10 people And the virus is hunting among those 10 people to try and find a host. But it's bumping into these antibodies that were produced by either the vaccine or, in your case, Mr. Neal, you've had COVID-19. The virus can't then do any damage to you or the person who's been vaccinated. So it's hunting for people who are vulnerable to the infection. Once we get that number down small enough, and it's probably out of those 10 people, probably 2, so maybe 80%, I think would be ideal. I've heard 70% as well. The virus will die out because it doesn't have enough people who are still vulnerable to the infection. So that's the reason we want to get as many people as possible exposed to the virus. But we've also had many millions of people, tens of millions of people who have already been infected with COVID-19. And that's why this question about how long does your immunity last, that's why it's really important, because we hope it lasts long enough for the virus to eventually die out, because it can't find enough new people to infect.
Dr. Fitzpatrick, I know that you can't stay with us the whole time here today. I just want to take this opportunity to thank you very much for taking time out of your very busy schedule to join us and share this information with us. And we hope we can get you back sometime in the near future. Give us some kind of update.
You certainly can. And I just, before I go, I'm sorry I'm going to miss the conversation about distrust, because my work is all focused on building trust. And what I've learned with respect to the Tuskegee experiment, or whether it's Henrietta Lacks, number one, you don't have to reach so far back to understand why particularly poor Black people are distrustful of the healthcare system. You can look at what's happening in the healthcare system right now to understand that. I think it's really important to acknowledge that, but we're dying at higher rates than anybody else of COVID-19. So we have to move forward at the same time. So yes, there's still a lot of work to do to acknowledge the injustices and what happened, and no, they were not given syphilis. The treatment was withheld. I'm just throwing that in because it's misinformation out there. These men were not injected with syphilis.
Talking
But
about
that
the
was
Tuskegee experiment.
That was 40 years ago. We still remember, and we still need to acknowledge it, but we also have to find a path forward because we are dying. So thank you so much for having me, and I look forward to being with you again.
Thank you so much. God bless.
Bye-bye.
Bye-bye. Thank you. And also, just kind of piggyback on that, she's 100% correct. They weren't given syphilis, but they were misled and told that they were being treated for bad blood at that time. But in essence, they were given, for all intents and purposes, they were given placebos. And basically, it was what was being watched was the actual natural progression of syphilis. And even when penicillin was available and they found out that penicillin was the treatment of choice for syphilis, they still withheld that from the participants.
So that raised all kinds of ethical considerations, not letting them know what was going on with respect to all of that.
And it wasn't until 1972 when a news story broke. And I think for all of three of us and a lot of people listening, we remember that year, and it didn't seem like that long ago. And to imagine from the 30s all the way up until 1972 that had been going on.
Wow.
40 years.
Wow. Delanor, you were raising a very crucial point earlier, and it was dealing with this question of distrust. And particularly in this instance, I'm talking about the African American community. Speak in broader terms as you choose, but I really want to drill down on the African American community, because the report is that anywhere from 30 to 40% of the African American community is saying, I'm not taking this vaccination. I'm not going to wear a mask. I'm not. It seemed. What? give us the foundation of that. Give us your perspectives on that. What are you getting from the people that you deal with in your association and beyond?
Well, I like to, this is my second call to be on with Dr. Burns in the last week or so. And he talked about the Tuskegee Institute study, and he also talked about Henrietta Lacks. And so, Dr. Burns, would you talk about Henrietta Lacks one more time for me, because you did it so well before, and then I will talk about what's going on today about the trust issues.
Okay.
Sure. Miss Lacks, Henrietta Lacks, she was a woman who she went to see her doctor because she had been having uterine bleeding, and came to find out that she had cervical cancer. And what had happened was some of her cells from the cervical cancer were harvested. And ordinarily, those cells, when they're harvested, they only last for a certain period of time, then sort of die off. And what had happened was they found out that her cells were actually living, continuing to live. And in truth, Henrietta Lacks, her cells have done a great service to medicine, because her cells have been used to help develop treatments for everything from the polio vaccine all the way through HIV, and even up until this point now with COVID-19, her cells have been used. Now, the problem, however, was that they used her cells without notifying her. And also, it really wasn't until the mid-70s until they even acknowledged that her cells came from Henrietta Lacks. They pay tribute to her because they call these HeLa cells, HeLa being, because of her name, Henrietta Lacks. The problem with that would be today is that we have health privacy information issues here that, although they weren't instituted back in the early 1950s when this occurred, but still her name, everything about her, that was germane to all this was released into the public. And that's where the issue of the trust from Henrietta Lacks comes. But thank God, her cells have done a great service for medicine. It's just that she just was never given the accolades that she should have received.
Again, it raises
she
those
wasn't
ethical
given-
considerations. I'm sorry, go ahead, Don.
Oh, I was just going to agree with that, in that she wasn't given any, there was no money that her family received from that.
Mm-hmm.
And so that distrust, these are just two examples of many things that happen in our past. But what is really affecting African Americans and Blacks and minorities right now, it is how they're being treated in the healthcare system today. Mm-hmm. When many African Americans, Black, non-white people go to be involved in the healthcare system, what they tell these healthcare professionals are not taken seriously, or they're not even asked questions. The healthcare professionals assume they know what's going on with these individuals based on how they look, or their name, or where their zip code of where they live. Yep. And so this is an opportunity for us in the healthcare profession to examine ourselves and say, okay, what do we need to do to gain the trust of individuals who don't particularly look like us? Even with Dr. Burns and myself, we have some of the same challenges because we have degrees. And so they'll say, oh, you're not the same as me. You don't really understand what I'm going through. So we have to make those connections as well. We don't get a pass because of our skin color. That it doesn't work like that. So we still have to earn that trust. As you said, Senator Neal, you said 30 to 40% of Blacks and non-whites have said they're not going to take the vaccine. I want you to know that I'm seeing more like 50%. And it is very distressing, because if we're dying more, we're getting COVID more, and we don't take the vaccine, it means that there are going to be less non-white people in the world to help us move forward. And so we have to figure out a way to have that dialogue so that we can gain the trust. We can earn the trust, because
Well,
that's what we have to do. Earn it.
let me ask you a question, because earning trust takes time,
Because
and we don't have time. We've lost over 400,000 people disproportionately in the Black communities. I'm just wondering exactly, other than communicating what you all are doing here today, and I know you all are doing this constantly through every avenue that you can. I'm wondering specifically, shouldn't we, and I think it's gathering steam, shouldn't we be putting on a full court press? Isn't it that urgent in our community?
Well, Mr. Neal, I know from a physician standpoint, because of things that have gone on, historical and even today, we in the community have to, as physicians, and especially Black physicians, we have to reestablish communication with our patients. Okay, we have to be transparent about. We have to have transparent dialogue with our patients, but also we have to be examples as well too. In addition, for example, a lot of us have taken the vaccine, and we're actually posting pictures of us getting the vaccine, showing that yes, we talk about taking it, but we're also doing it as well too. Okay, and I do believe communication, transparency, and being example, leading by example, I believe those are the types of things that are needed to reestablish trust within the Black community, especially Black and brown communities, but in all communities as well too. That this is what we're doing. We're reestablishing the trust in medicine.
But again, that's long term, and the pandemic is upon us. The vaccine is touted as the moderating force in the world to get this thing under control. My wife, I delayed a trip last June because this thing unexpectedly hit, and now they've set it up for this June. I don't see how that's possible, you know, because we don't know. And now it looks like maybe a year out. But to do that, something has to happen now. I'm asking this question because the only thing comes to my mind is that we have to have a comprehensive, intentional, high priority approach at dealing with this. And we can't just do it superficially. We have to do it analytically. In other words, we got to look at the layers of resistance, and then we have to appropriately engage them. And I don't have the answer. Don't get me wrong. This is just the way when I look at the broad picture. I'm asking you guys. You guys are on the front line. Come on. You're on the front line. What is it we can do now? Delanor.
Well, as Dr. Burns said, being an example and leading is great. Doing some of these PSAs and going to, what I know Dr. Burns and the Falls City Medical Group and the Kiana Nurses Association is, we're going to
Tell
churches.
us who they are. Tell us who they are.
The Kiana, this is the Black Nurses Association in the Louisville area. And there's also, excuse me?
Falls City?
Well, Falls City, that's the Medical Association, the Black Medical Association.
Okay.
Yeah.
But we are going to churches. We're doing family units. We are out there. I mean, I would say this week alone, I've talked to 6 groups, and I don't care how small they are, but I really want them to be, groups where we can do Zoom meetings, where we can talk and they can ask the hard questions, things that they might not ask their physician or their nurse that they see, but they see someone that they know on a Zoom meeting where they can say, okay, is it going to make me grow a tail? Or is it going to make me lose my hair? I mean, is it going to change my DNA? How soon can I I mean, these are questions that they have that somebody needs to answer. And I agree, Senator Neal, if there was a broad program where we could do it on the loudspeaker and roll through the communities and say, listen up, I'm still not sure that that would make the difference. It's that connection. And when I tell 10 nurses, they go out and tell 10 more people, and they go out and tell 10 more people. But it's that relationship that has to happen quickly.
My observation is that you're absolutely correct in my probing through this particular issue. And I agree. And that's why I'm raising the question over and over again. I'm sure you are too, because just a megaphone is not going to do it. I agree with that. It's not going to do it in the short term in doctors' offices, although it must, what Dr. Burns is speaking of, must happen, and not in Black doctor's office, white doctor's office as well. But I think, let me give you my thoughts. We're going to get conversational here. Here are my thoughts. I don't know who you're talking to, CEO of the Kentucky Nurses Association. I don't know who Dr. Mark Burns, who's an educator. He's not just a physician, he's an educator. He's imparting knowledge. He's gaining knowledge. I've done adjunct work historically at University of Louisville for about 10 years, and I tell you, you learn about as much as you give. You learn as you're going, right? So it's that exchange. So when I look at it and look at my own experiences, I think, guess what? This is the first time I've talked to you, Delanor, in a while.
It is. And
I've always known you to be out there doing it, right? And just by virtue of what Dr. Burns does, he's doing it every day. That's what his job is about. That's what his life is dedicated to. That's what his educational background. But this is the first time I've talked to Dr. Burns, and I haven't talked to you in a long time. You're talking to a lot of other people. Dr. Burns is talking to a lot of people. I'm wondering if we shouldn't be creating an ever-growing interconnection between those who are like-minded, that have varying levels of skills and knowledge to impart, so that we can do what you just said, establish a wide range of relationships. And let me just say this, relationships, most people sort of function in their own little universe of people that they know. Some other people may look upon them and admire them for what they do, etc. But when you're talking about the relationships you're talking about people who trust you when you say something that you might listen to, regardless of what you believe. Let me tell you, I've run into levels of this stuff that you wouldn't believe, or maybe you would believe. I'm gonna give you one example.
Probably.
Shut up, and I want you to respond, both of you. I walked into a neighborhood store, one of these little stores, and I wanted to get a soft drink. I walked in, I had my mask and all that stuff. I was feeling pretty good that day. And I walked in there, and as soon as I got in there, there was about 5 or 6 people in there. Only one of them had a mask on. That one person that had the mask on had it under their nose. Okay? In other words, he's breathing it out their nose. And the guy that was giving service had no mask on. Yeah. I ran out of that store. See, I ran out of that store. But let me tell you, and I thought about it, it really ticked me off, actually. That was my initial response. And I wasn't going to say anything to anybody because, you invade somebody's space. There's no telling what the response would be. But I'll tell you this. Then I cooled off and I thought about it. And I said, that's an ever-present danger.
It is.
Not only to themselves, but to our community. So I began to really look at that. So now, and I saw that in a Kroger store. Now I walk in that same Kroger store, boy, the one I went into, they policing it. You got something below your nose, they're on your case. I got to tell you that. That's where, and increasingly I see the mask wearing, but I go back out in some of these places I've been probing, and I see to a lesser degree, but still that sort of thing. Or I go through the neighborhood and I see these groups of people interacting as if they're not the same family. As if nothing is going on. So I'm saying there's another level of folks that, it doesn't apply to. And then there's disbelief that it's relevant to them. It can't affect me. that's somebody else. Or I can take my chances because look at all the other people didn't die. I
Right.
didn't end up in the hospital. How do you get through that? I think it's through relationships, but how do you get to those relationships?
Well, without getting too political, I
Don't
do
get
believe,
political. It's fine. That's what I do.
Oh, Mark.
It's okay.
Whoops.
well, I can, I'll try to keep it just to the scientific arena as much as I can. That's my area of expertise. I'm not.
All right.
But I will say this. I believe leaders can also lead by example. And I truly believe two things. Number one, I think if leadership, and I'm talking on a national level, leadership had emphasized the importance of wearing masks because they actually did quite the opposite, initially. Leadership emphasized the importance of wearing masks, and present leadership now is definitely emphasizing the importance of wearing masks. But my point is, I think if leadership would do that by example, because they're the ones that are most visible, okay, the ones you see the most, I think now, would everybody wear a mask? Of course not. Everybody wouldn't. I don't care. Everybody wouldn't wear a mask, but I do believe the vast majority of people would realize, well, hey, our prominent leader is doing this, so we should probably follow suit and do that as well. That's my opinion about it. But I think the more that we're out there, the more that people see visibly that yes, you need to wear a mask. Yes, you need to follow those public health measures, wash hands, social distance, avoid crowds. When everybody's doing that, and again, it's coming from the top. I think you'll see more people doing it. That's again, just keeping it in the scientific arena. That's my view.
Well, I agree with you on that. And I would add one thing to that. The top means the top of the state. I think we got that in our governor in Kentucky.
Yeah.
That means the top of the House of Representatives and the top of the Senate and the top of the city governments and the top of the this and the top of the that. I agree with you totally. And you know what you just did? Something just clicked in my brain that says I got to be part of that dynamic that challenges the tops wherever I can find it because of what I do as a state senator.
Not only the top, but the tippy top.
The tippy top, all the way to the top. Not just any old kind of top.
Right.
The tippy top.
Tippy top.
Well, and one of the things that I think that we can do.
Wait a minute, Delanor, before you do that, tell folks what kind of degrees you have. You're not just a CEO of a Kentucky Nurse Association. You've worked your whole life to do the things you do. What's your degrees?
Well, I have a degree in nursing and I have a degree in health services administration. But one of my claims to fame is that I served the United States Navy for 27 years and I retired as a Navy captain. And what that means, it has a huge swath on leadership and the ability to get things done, to organize things, to make them happen. And that's why I'm in what I consider to be the best job in the world. Sorry, Mark. That I get to serve nurses. I get to serve 88,000.
See, she's not sorry about me. She's just sorry about you, Mark.
Well, and the other thing, I do own an art gallery, which Dr.
Right.
Burns and Senator Neal know about.
Yes.
But the
outstanding art gallery.
well, thank you.
Yep.
But the main issue is that my specialty is in organizing and making things happen. And that's part of my responsibility as a nurse as well.
So you were getting ready to make a point. Yeah.
Thank you. But one of the things I like to challenge every nurse and every healthcare professional to be part of that leadership team that gets it done, to share the information about the science and to help debunk the myths about taking the vaccine, and also share how important it is that we get to that herd immunity. And it's every last professional. It is all of our responsibility to tell the story and to tell it every day. We started on a campaign about 3 months ago, Senator Neal, we wanted every nurse to talk to 10 people every day
Mm.
about testing and the vaccine, because we still need to get tested on a regular basis. And there is so much reluctance to get tested because I need to talk to my doctor about that. No, you do not need to talk to your doctor about
Go
getting
get tested.
Okay. It doesn't hurt, and it's readily available. And if I remember correctly, Dr. Burns, we've decreased our testing in the Louisville area by about 40%. And so we have testing available. So if you're in an environment that Senator Neal mentioned, or where you're in that store with those 5 people who don't have on masks, and you're in an enclosed area, you need to get tested. You know, if you went to that funeral to honor that person that you loved, and those people were not wearing masks and they were singing and having words, you need to get tested. We have excess testing capacity that we didn't have, through this whole episode. So get tested, and then continue with those social distancing and wearing. One person told me today that they ran out of masks. They had to order some more from Amazon. And I said, well, what about all those masks you've had before that are cloth? Did you wash them so you could wear them again? Oh, I didn't know I could do that. You can wash the mask, hot water and some soap, let them dry. You can wear them again. You don't have to throw them away. So if that's the excuse for not wearing the mask, that's over. Wash that mask, let it dry, and wear it again.
Yeah. Well, we have about 6 minutes left, and I want to make sure that we get to the points, bring this thing to some point of agreement here. And I think we have approached that actually. The message here, the message that I'm hoping that we're sending out, and I'm trying to pick out these different pieces, is that we have to do more organizing, messaging, and broadening the relationships to deliver those messages in a continuous way. That's what I think I'm hearing.
Yes.
Yeah.
So that means wherever we are, from the tippy top, as Dr. Burns would say, all the way down to, the person in your neighborhood that may be slightly isolated socially, but does interact with the public, don't take them for granted. Find a way to relate. And I'm thinking a positive way. You don't get anything by challenging somebody in a negative way. That just pushes them away, makes them defensive. So I think we ought to be thoughtful about it and not just beat up on people's heads. But let me ask another question. We've homed in on the Black community. But I'm gonna have to tell you, I've seen a lot of cognizant. How do you pronounce that word? Cognizant.
Cognizant.
Oh, I was saying it right. Cognizance dissonance.
Cognizant.
Yes, in the white community. The Black community is getting this adverse effect. I'm wondering. In terms of participation, I'm wondering what that rate of participation is in the white community. Is there some information available on that?
There was a study. It's called the Pew study. Pew is a think tank out of Washington D.C., and they did a survey about taking vaccines. And at the time the survey was taken, 60% of whites would agree to taking the vaccine. It was also noted that about 42% of Blacks were only interested in taking the vaccine. Okay, so in other words, the vast majority of Blacks were saying no, we weren't going to take the vaccine. But there are several different studies that have been out questioning whether people would take the vaccine. Now, they also noted that after having dialogue with primarily a physician or someone who was knowledgeable about it, they were able to change their minds or at least be more open and more open to actually getting the vaccines. The so-called vaccine hesitancy that's out. hopefully, those numbers had been knocked down some. Still, there are going to be quite a few who have this vaccine hesitancy, but we still have to have more dialogue to try to overcome this.
Well, it gets back to what Dylan said. You're getting back to that issue of relationships and trust.
Mm-hmm. Yep.
You see, you're not going to trust somebody you don't have some relationship with, right?
Well, that and also I think people that speak about it, that are very knowledgeable about it too.
Yeah.
A perfect example is with Dr. Fauci. I mean, there are a lot of people that don't know Dr. Fauci, but they do trust what he says because he's been upfront and truthful and straightforward about COVID.
Well, that brings me. I'm sorry. I know you don't want to get political or anything like that. You can defer as you choose, but that brings me to Senator Rand Paul, who I'll do the talking. You don't have to do anything here. This guy's got to be out of his mind. He's not an expert in this area. He has a background that should make him sensitive to questions of science and so forth and so on. I think he's in dentistry or something like that.
He's an ophthalmologist that said he was board certified, but he really wasn't nationally board certified. He had his own board.
But he has some training in eye, treating eye, whatever, with respect to eyes. My point is he should have some sensitivity, but yet he would challenge and ask people to dismiss Dr. Fauci, who has been an infectious disease epidemiologist and more for almost his entire life, the top physician regarded worldwide and certainly in the United States. And here we have a politician who should have enough sense to understand what that all means. That to me, that's incredulous. I'm incredulous behind that. And
I would like to say, Senator Neal, that I'm going to go back to what Dr. Burns mentioned about leadership.
Yeah.
Real leaders would get the information, have the accurate information, share the accurate information, and make sure that as they are sharing it, that they tell the people that they're sharing it with, take this, go forth, and you share it as well, because this is the truth. Based on transparency, based on science. So it's the leader's responsibility to share the accurate information. And if a person is not sharing the accurate information, then are they fulfilling their role as a leader?
And let me just say this. I must share this. The General Assembly is in session. To the General Assembly's credit, and before we went into session and we were meeting, maybe 5 of us were wearing masks, and I was ducking and dodging everything I could. And now masks are required in both chambers. But guess what? In the House of Representatives, they can lodge their votes virtually from their offices. In the Senate, we must be present on the floor to lodge our votes. And we have a smaller chamber, it defies logic to me. And so still I'm running around ducking and dodging, trying to avoid and carry out my responsibility. We got a way to go. That's all I got.
We do.
Delanor? I said, Delanor, I want to put doctor in front of that because I'm with these 2 doctors today because I hold you in the highest regard. Dr. Burns and of course, Dr. Fitzpatrick, who had to leave us early. I cannot tell you how thankful I am that you've taken the time to share this information. There will be some times I will get back with you. In fact, when we're through, I'll probably get in touch with you and, hey, what information you got that's useful to me in carrying out what we're talking about and things I don't know that you think would be useful. I hope you'll be available to me. I want to thank you all for joining us this morning and sharing this information here on Straight Talk. I want to encourage those who are viewing to share this information. This is not about just the speakers here. This is about you. You should be a purveyor of truth. You should extend your discussion to others. Start your own campaign, start your own Facebook Live, start your own whatever, start in your family, go to your neighbors. But this is important. We've lost over 400 plus thousand people to, in some degree, I have to say it, ignorance. And ignorance is might be the biggest disease you can experience out here
So,
because it leads to all kinds of consequential outcomes.
Senator
So,
Neal, can I just say one thing before you go?
yes, please.
Just have everybody. I think if they would approach things like this, think more of the other person than you do yourself, and I think that would go so far into solving many of these problems.
What a great way
Eleanor?
to end. That was a great way to end. I don't want to top that. That was excellent. But Senator Neal, I would like to talk to you about going into session from a nurse's perspective. So when we finish with this, maybe sometime this week, we could chat again.
Why don't you call me over the weekend? We'll do that. Okay.
Thank you, sir.
So you've heard and you have the last word. It's all been said here today. Signing off from Straight Talk. And as I always say, do the right thing.